Hi, friends. It's been a while since we've had a chance to update you on our family since the accident. Last fall, last October, I left the hospital, and those first few months were spent really getting to know what this new reality is going to look for us in this new home to us, in this new reality of what it's like to live a paraplegic life. And then winter came, and as you know, winter here in Michigan can tend to keep people indoors. And then COVID 19 hit. That meant having to stop all therapy, all food donations, all attendant care. But it's been tough for all of us, right? God has been good through this time. Our family's drawn closer together. All our needs have been more than met. And then finally, the warmer weather of spring came out, and that was a huge help. In the absence of giving you guys more updates, we have received a lot of interesting questions. Does Sarah have to take care of me all day long? Does she have to supervise me at all times? Rob's back at work, right? Is he full time yet? How are the house modifications coming along?
Please admire our beautiful bathroom cutout, which we've been enjoying for 10 months now. A quick and dirty job to get Rob home. Why it's still like this is for another video. We had expected things to change a long time ago, which is also what explains our beautiful privacy door.
Why in the world would I need to pop a wheelie? Why would I need to learn that skill on a wheelchair? So we hope to be able to answer some of those for you. But today we wanted to focus specifically on my lungs and how that is related to COVID 19. So, why talk about my lungs, you say? Didn't the accident leave you paralyzed, spinal cord injury, stuck to this wheelchair? Yes, but it was my lungs that almost killed me twice in the ICU and were the main reason why I had to stay in the hospital 5 months. First, let me give you a quick summary. I was in the car accident last May of 2019, broke a bunch of bones, including 7 ribs on my right side. That tore up that rib pretty bad and it collapsed. So immediately they intubated me, they attached a bunch of drain tubes to my chest to try to drain the liquid and the air that was building up in my lungs. So over the next 2 weeks, the right lung got infected. It was struggling to get better. And then the left lung said, hey, I want to be part of the party. And so it joined in on the fun. They were both in distress, and being on the ventilator long term eventually meant that I went into ARDS, acute respiratory distress syndrome. It's basically saying the lungs are just filling up with fluids and just really struggling to breathe. It's what a lot of COVID 19 patients are dealing with when they're in the hospital these days. And so eventually the doctors, the last resort they had was ECMO. It's an expensive machine that takes all the blood from the body, puts it through this machine that oxygenates that blood, puts the blood back in the body. It's a way of having the lungs have a chance to rest and to heal. It's about a 40% chance of survival for those that get put on ECMO. It's like flipping a coin. And God, for some reason, had a reason for that coin to land on the right side for me. All right, so now that we're all on the same page, some of you may not have known all the history. Back to the original question, which is just how does this affect your daily life? What is your lung health like? Well, there goes my audition for American Idol. Can't sing well anymore. Plus, I can't make out with Sarah like I used to. I gotta pull away just to catch my breath. So, all that infection and trauma to the lungs basically gave me a long term condition called bronchiectasis. In healthy humans, you have mucus present in the bronchial tubes. It helps contain dust, it helps with bacteria, just like the nose. It's a protection mechanism. And I guess throughout the day, through coughing, swallowing, you get rid of that mucus. You don't even think about it, it just happens. With bronchiectasis, there has been some scarring to those tissues, and so they're wider than normal. And that can lead to the mucus building up more in those bronchial tubes. It's harder to cough up, it's harder to get rid of it. And so when it settles there, you get infections, you get more pneumonias. When you've got flare-ups, you've got wheezing, things like that. So what do I do to keep those airways clear so I can breathe deep? Well, naturally, I've taken up vaping. I mean, it's cool, it's relaxing, keeps me stylish.
No more vaping! No more vaping! No more vaping!
Two things to keep airways clear. I've got to loosen that mucus and then encourage that coughing. To loosen the mucus, I use a nebulizer. It's a machine that turns liquid medicine into vapor that then I can just breathe directly into my lungs. In my case, I do once a day for 15 minutes a saline solution. So after the nebulizer, I switch over to the cough assist machine. In the old days, you would have to just use traditional old vacuums and they would just suck your lips for suctioning. Now with this new machine, it basically uses positive air pressure to fill up your lungs, mimicking a deep breath, and then with negative pressure, it is a vacuum-like force. It helps you cough and get things out. And then I'm blessed to have a standing wheelchair function in my power chair, and that really helps keep me straighter in some periods of the day because I tend to be a little bit more hunched over when I'm in the regular wheelchair. So the last question is just, how does COVID-19 impact all of this? It sucks, I'll be honest. I've never had to deal with a label of being at risk with something. I've always been blessed to be healthy, but now I have more appreciation for what it means to be vulnerable in a certain way. And in my case, it relates to the lungs. I've had to be a lot more careful during this quarantine. I've had to stop all in-home visits at the beginning and so on. It really kind of put a really hard brake on all sorts of activities and progress I was making. But it's okay. Telemed visits have kept me healthy. They've kept me going. This decision is personal. Obviously, everybody's going to do it differently. But Sarah and I have talked and we've decided, we can't just be stuck at home, fully quarantined for yet another year until they come out with a vaccine or some other solution, or until we learn more about how COVID-19 works. So we're slowly taking risks, still much more cautiously than a lot of people, but there are safe ways of doing things. And so we're enjoying getting out into the community more little by little, and we'll get through this. All right, that wraps it up. You really must care if you've stuck around to the end of this video. Thank you. We do appreciate all your prayers and your continued support in many ways. And hopefully we'll be putting out a few other videos to help answer some other questions that have come around. See you next time. That was way too long. So all that... Why talk about my lungs, you say? There's a reason right there. Well, it was actually my lungs that killed me twice. We're truly